There are many severe malformations in the baby which can affect whole body and many other organs, and which can lead to paralysis in the body or bowel and bladder dysfunction, intellectual disability, and even the short lifespan. One of which severe malformation which involves brain and spinal cord are called as neural tube defects. For example, anencephaly, spina bifida, meningocele and meningomyelocele, etc. Today in our video we are going to discuss about these malformations and how we can prevent them. Hello everyone, myself Dr. Kiran Sri Chittala, Fetal Medicine Consultant, New Hospital, Nagpur. Please do subscribe our channel for regular updates on fetal and maternal medicine. Neural tube defects are the severe malformation which affect the brain formation and spinal cord formation in the babies. And the incidence of neural tube defects is 1 in 1200 to 1400 in live births. There are 5 simple ways to prevent those malformations in the babies in a pregnant woman. Let's explore those ways. How can we prevent such severe malformations in the baby? Starting with folic acid supplementation, which is recommended even in the preconceptional period, that is even before you plan for the pregnancy. At least 3 months before the conception, you should start the folic acid supplementation, and you should continue these tablets at least 3 months after you conceive. The dose of folic acid is around 400 micrograms per day. Second way is to manage your pre-existing health conditions, like optimize your diabetic condition and optimize your obesity. That means you have to manage your weight within the BMI limits. Third point, family history. If your previous baby is affected with the spinal cord defects, or yourself or your husband is having the spinal cord defect since the birth, that means there is increased risk of having the next baby with spinal cord defect. In such women may require higher dose of folic acid supplementation, like 5 mg per day dose is recommended. And these women may require few genetic testings like MTHFR mutation analysis. Fourth point, certain medications like anti-epileptics. Women who are having epilepsy, means seizure disorder, they are taking high risk medications like valproic acid, phenytoin and carbamazepine. By taking those medications, there is increased risk for the neural tube defects. If you are planning a pregnancy and you are also taking the anti-epileptic medications, you should consult your physician to change your medications to pregnancy safer medication. Fifth point, overheating or high grade fever in the early pregnancy can cause spinal cord malformations. So whenever you are having high grade fever or exposure to the overheating in the early pregnancy, you should immediately consult your doctor and take precautions. These are the 5 simple ways to get a healthy baby and to prevent severe malformations of spinal cord and brain in your baby. Please do get advice from your obstetricians before conception if you are having any high risk factor for neural tube defects. If you have any doubts regarding this subject, please do mention it in the comment box. Thank you.